Meet Amina. She is 32 years old, and lately, waking up is the hardest part of her day. Her hands feel stiff and puffy, making it a struggle to even hold her morning mug of coffee. Across town, her 65-year-old aunt, Mama Joy, is also dealing with joint pain. She rubs a creaky, aching knee before heading out for a busy day at the local market. When Amina mentions her stiff hands to her friends, they usually brush it off. They assume aching joints are strictly a sign of getting older, a problem meant for people Mama Joy's age, and something Amina shouldn't have to worry about for decades. But these two women are experiencing very different conditions. Mama Joy's pain comes from osteoarthritis. Over decades of hard work, the protective cartilage capping her knee bones has slowly worn away. It is a mechanical issue caused by simple wear and tear. Amina's pain has a completely different source. She has rheumatoid arthritis. This condition can strike at any age, whether you are 30 or 60. It happens because of an autoimmune reaction inside the body, completely unrelated to normal aging. Assuming all joint pain is the same natural aging process is dangerous. Treating physical wear and tear requires a vastly different medical approach than trying to stop an internal immune misfire. To understand that misfire, think of your normal immune system as your body's dedicated security team. Its only job is to patrol your bloodstream and fight off dangerous outside invaders, like viruses and bacteria. In rheumatoid arthritis, the security team gets confused. It mistakenly targets healthy soft tissue lining the inside of your joints, treating your body like a threat. The area fills with fluid and inflammatory chemicals, causing the joint to swell, feel hot, and throb with pain. Doctors are still studying exactly what causes the immune system to make this mistake. Current research shows it comes from a combination of inherited genetic traits and environmental triggers, like smoking, which can agitate the immune system over time. Because this is an active internal battle, the pain will not simply go away with rest. It requires a specific medical intervention to tell the immune system to stand down. You can usually spot rheumatoid arthritis through a very specific physical pattern. It almost always creates symmetrical swelling, meaning if your right wrist hurts, your left wrist usually does too. It typically starts in the small joints of the hands, wrists, and feet. Another major warning sign is how you feel in the morning. While regular aches might loosen up after a few minutes of moving around, the severe morning stiffness of rheumatoid arthritis usually lasts for more than an hour after waking up. The disease also takes a heavy toll on the rest of the body. That constant internal immune battle drains your energy, causing extreme fatigue and generalized weakness, and a loss of mobility that makes basic tasks like buttoning a shirt feel impossible. This X-ray of a rheumatoid arthritis hand shows why treatment is urgent. Yellow arrows point to soft tissue ballooning from swelling. Small yellow arrowheads reveal where chronic inflammation has permanently eroded the bone itself. Once destroyed, bone and cartilage cannot grow back. Ignoring these specific warning signs allows that invisible, irreversible damage to keep happening in the background. Identifying the disease early is the most crucial step in saving your joints. There is a persistent myth that once rheumatoid arthritis begins, you simply have to accept the pain and loss of movement. That is entirely false. The primary medical solutions are treatments known as DMARDs and biologic therapies. You can think of these medications like specialized software updates for a glitching security system. Standard painkillers only mask the discomfort. These medications go to the source, reprogramming your immune system so it stops attacking your healthy joint tissue. By giving the immune system the right instructions, these treatments cool the inflammatory fire and successfully halt the permanent destruction of your joints. Many people fear that moving an inflamed joint will make the arthritis worse. In reality, safe, controlled exercise is vital for keeping your joints flexible and building the surrounding muscles to support them. You can complement your medication with daily strategies. Physiotherapy helps restore range of motion, adaptive tools take the physical pressure off your hands, and a healthy diet helps reduce overall stress on your body. With the right treatment plan, Amina is managing her condition beautifully. She is regaining her strength, moving without any pain, and getting back to the physical activities she loves. If you regularly wake up with stiff, swollen joints that take hours to loosen up, Do not wait for the pain to pass. Speak to a healthcare provider immediately. A rheumatoid arthritis diagnosis will change your daily routine, but with early medical action and the right lifestyle adjustments, it absolutely does not have to define your life.